At TFL, we're not just delivering packages, we're delivering hope, health, and peace of mind.
Thanks to TFL, we can continue providing the best care for our patients.
In the world of healthcare, time is of the essence. That's why at TFL, we understand the urgency behind every medical delivery. From life-saving medications to sensitive lab samples, our team is trained to handle every shipment with the utmost precision and confidentiality. When it comes to medical deliveries, trust the experts at TFL. We also transport anything else that can fit into a cargo van besides dead bodies.
Thank you, TFL. You guys are lifesavers.
TFL, we understand the importance of reliable and efficient deliveries. That's why we're committed to providing top-notch service every step of the way. Trust TFL to be your go-to courier for professional, safe, and on-time deliveries.
All right. Welcome everybody to Smooth Life Podcast, a podcast where we talk about peer experiences and all, and where they're currently going, where they're trying to go to, and all. So, this podcast, I would say this is a very special episode because this woman right here, we been through a lot. I'm talking about since youth church, going on trips together. What else? Praise dancing. What else? It's a whole lot I can actually say. She's born in Jamaica. She married one daughter. Golly. Married one daughter. She's an author. She's a health care professional and a health coach. Then everybody give it up for Tesha Scott.
Hello.
Yes. So, very first question I'm gonna just ask you and all. How was your childhood? Beginning with healthcare. What else? Healthcare, being an author and a health coach.
Okay. Like I said earlier, I've always loved health. Growing up, that was my favorite subject in school. I love PE, athletics, all of that. So I guess that's where it started, just from school and just loving that subject of health.
Mm-hmm. Okay. So I recently was on your website, www.coachtesha.com, and
Mm-hmm.
I saw that you on your third book now.
Right.
Soul Care. I actually did a commercial for you, and
Yeah.
tell me about the book. Like, what this means to you as being the author, and all.
Yeah. So I did write two books previously, and then this third one is actually a journal. It's a journal. And this kind of came about through COVID,
Mm-hmm.
because COVID was a trying time for us. And for me, going through COVID and working in healthcare, seeing people lose their lives every day, writing for me and journaling was like an outlet that helped me emotionally and mentally, just dealing with seeing people die on a day-to-day basis
Mm-hmm.
when I couldn't do anything about it. As a respiratory therapist, people come into the hospital all the time, and we're able to help them breathe and we're able to help them live. But when the COVID pandemic came around, it was like we couldn't do anything and we had to watch them just suffer and
Mm-hmm.
they lose their lives. And so writing for me during that time helped me a lot, cope with, what I was seeing on a day-to-day basis. So
Mm-hmm.
that's kind of where the journaling came from, and why I wanted to create a journal for other people that may be struggling with something that they have going on and they don't want to talk to someone else. You can actually write out your thoughts. I've got questions in it that'll help anybody that would go through it. It'll help you if you're feeling stuck in life. But I mean, that's kind of where it came from. Yeah.
Right. I know, yeah, like you said with COVID was a very hard time. And so
Yeah.
I just want to ask you, like, how was it with you and going through COVID and everything, especially being in the house with your family and all and not going out and had to put the mask on? How was that experience?
Oh man, it was rough because we didn't know what was happening. We didn't know what was going on. When I would come home from work, I would take off my clothes like right at the door because I didn't bring any germs into the house.
Right.
Initially, it was like I would wear a mask in the house because, like I said, we didn't know what was going on. So I mean, it was really, really hard. I wasn't staying close to my daughter because she was young. My husband, I was like, look, we got to stay, feet apart, 3 feet apart, whatever it was. But it was just, we were just trying to do everything we can to prevent the germs from coming in the house. It was really, really tough. Yeah.
Okay. So next question I was going to ask you, how did all your professions, would you say, entwine with each other?
I'm a respiratory therapist. I'm a health coach. I help women lose weight. Like I said earlier, like I love health and I just love the human body and I love helping people when it comes to health. And that's how I kind of feel that they intertwine together. And as an author, the type of books that I write, they're to help you emotionally or mentally or spiritually. So in all aspects, you could say it's a holistic approach where I'm just helping you overall. And so that's how I feel like they intertwine with health.
Okay. Did you see yourself being an author though? Like ever start writing and all?
Definitely not. Definitely not.
Why is that?
It was just something that I just didn't think was possible. Growing up, you never saw an author walking around, that I knew of anyway. You always thought an author was a famous person. You get what I'm saying?
Yeah,
So
right.
it never really crossed my mind that I
Right.
could do something like that. Yeah.
Okay. How does being a health coach and like how can I actually put this question? I want to say, um, uh, I had the question in mind. I wanted to ask you about being a health coach. I just can't put it in words right now.
You come
And
back to it.
yeah. Let me come back to that one. And
Yeah.
so the first and the second book, like talk about that more. Like how was that experience? And
Okay, so the first book I got all of them right here. So the first book was Dance in the Rain, and this one is pretty much like a little, what's the word? Almost like a little biography or a memoir, so to speak, where it shared different experiences that I went through in my life that kind of shifted my life, shifted my life in a good way, not a bad way, but they shifted my life. One was me joining the military that really, really changed the trajectory of my life. And then the second one was losing our son. That was our first child we had. We lost that through preterm labor. And then my husband, he was shot. So those three things really impacted my life
Mm-hmm.
tremendously. And so I wanted to write about it to share with other people that have gone through traumatic experiences in their life and think that they can't get through it. So
Right.
that's what this one was about. The second one was basically piggybacking off of the first one, After the Rain. The first one was called Dance in the Rain. This one, After the Rain. And it basically is just showing how I got through what I went through, and
Mm-hmm.
just things that I did to help me cope and get through those tough times.
That's
Yeah.
good. That's good. Good. I know it was hard just because I remember I did hear about the news whenever your husband did get shot. And well,
Mhm.
let's speak on that. Like, how was that experience and whenever
Oh,
you got that news?
I was actually on the phone with a friend, I think. I made him lunch and I had texted him. And no, let's go back. Let's see, where was I? I was going to pick up my daughter, and on the way back from picking up my daughter, I saw a state trooper fly past me, zoom past me, and I'm like, "Hey, where they going?"
Uh-huh.
So I got home, I was on the phone talking, and I think my friend was like, there's a whole bunch of officers going down such and such road, and I'm like, okay, really? And I didn't think nothing of it.
Mm-hmm.
Then I got home. I texted him. I can't remember what I texted him, but I didn't get a response right away because normally, he responds right away. Then a few minutes later, he called me, and the fact that he called me, I wasn't thinking anything,
Right,
anything
right.
crazy. But the first thing he said, he was like, "I'm hit," and I was like, "You're hit," which I already knew what it
Right.
meant. I've been in the military, and I was
Mm-hmm.
like, okay, let me get, my daughter together.
Mm-hmm.
And he told me where he was going, what hospital. So I was like, okay, let me gather Mariah's stuff together. Took her to my sister's house, and I went on my way. And on my way to the hospital, I was like, okay, what I need to do. I called my job. I was like, look, I'm not going to be in tomorrow. you I didn't
Mm-hmm.
tell them necessarily what was going on because I didn't know all the details.
Right.
But during the moment, I don't know. I can't say what my emotions were. All I know is
Mm-hmm.
I was okay because I knew he was okay. You
Mm-hmm.
know. Yeah. But it was a surreal experience. Put it like that.
Right. Mm.
Hmm.
Wow.
Yeah.
I know that was tough going through
Yeah.
that. And
Yeah.
um did it affect any of the other professions and all during the
What,
time?
what do you mean?
Like as far as like being a health coach and being a healthcare professional, did it affect any of those professions?
No, I wouldn't say it did. I
It
wouldn't say
didn't.
it had any
Mm,
effect. Yeah.
mm,
Yeah.
that's wow.
Yeah.
Cause I remember I heard the news whenever he did got shot, and
Oh,
I didn't really know how to actually process that, and because I remember growing up and being always in his presence whenever when we go
yeah.
to church and all, and he always smiling, always being funny, him being him, Travis
Right.
being Travis, and so it's like whenever I got the news, I was discombobulated. I was like, what?
Hmm.
I was like, nah, but in the back of my mind, I always knew that he was gonna make it through. So
Yeah.
I know he's gonna be all right. And
Yeah.
so like we said before, and um, you got a daughter now, so
Mhm.
talk about that experience. Like you say, you just lost your son. You lost your son, your first son, and
Yeah.
so how was that experience regaining and getting a daughter?
Yeah. So it was 2015. Okay. I was like 5 months pregnant or whatever.
Mm-hmm.
And preterm labor, basically he was too young to survive. I gave birth, but he was too young to survive or do anything to try to make him survive.
Right.
And really during that process, it was a choice of my life or his life. I could have kept the baby in, but for I think it was 2 weeks, 4 weeks, something like that. But there was a risk of me doing that I could have lost my life as well. So it
Mm-hmm.
was, that was a tough situation and a tough decision. And then a year later, I think it was a year later, we got pregnant again and gave birth to my daughter a year later. And during that pregnancy was tough for me because of
Mm-hmm.
what I experienced during the first pregnancy. So,
Mm-hmm.
I had a little, I'm not going to say anxiety or anything like that, but I was more cautious with this second pregnancy. Um, of course, I did a lot of praying.
Right.
And I was labeled as high risk during that pregnancy. And what that means is there's certain things that you cannot do. I wasn't on bed rest or anything, but there were certain things that I could not do. So that limited me in my work as a
Right.
respiratory therapist, limited my physical capabilities, working out, all of those things. So it was a trying time.
Mm-hmm.
Um, but we were blessed with Mariah, and we're grateful and thankful. The labor and delivery went smoothly.
Mm-hmm.
Um, yeah.
What type of support did y'all have when going through that, and especially
Um,
like losing the first child?
yeah. Support as far as what do you mean? Like,
Like it's like, okay, when I say support, I knew that whenever losing that first child, I know that was hard for y'all. And
yeah.
so was there any type of support whenever you knew the second child was being uh born and all during that process?
You mean emotional support?
Yeah, emotional support. That's what I meant. I'm sorry.
It's okay. During the second, one thing about me and during that time is I was closed off. So it was like I didn't necessarily allow people in. You get
Hmm.
what I'm saying? So I don't know. I'm gonna say I'm not sure because I was closed off during that whole time from losing my son to giving birth. I was more closed off. Yeah.
Okay. Okay. All right. That's good. That's good. Um, let me check my next questions. And what advice would you give somebody going through the professions that you in now? What advice would you give them?
As far as healthcare, I would say you definitely have to be a patient person.
Right.
You got to be a patient person. You definitely have to have tough skin because dealing with your coworkers, dealing with your patients, they will say
Hmm.
things to you, not knowing that you're there trying to help them. So I would definitely say you have to be patient and have tough skin, and
Hmm.
definitely know what you're getting yourself into. Yeah, because they're long hours. You literally the hospital is open 365 days and it met holidays, so you got to be flexible.
Hmm.
Yeah, if you're a type of person that don't want to work on the weekends, please do not join healthcare.
Right.
Yeah.
Okay. Okay. Let's talk about your childhood experiences, like being born in Jamaica, because I know
Mhm.
that's wow, that's incredible. And
Yeah.
so talk about that, like your experiences growing up in Jamaica.
I was very, very young. I came to the US when I was 7, so I don't remember a lot, but the
Uh-huh.
things that I do remember are, significant. My mom, she came to the United States first, and then she
Uh-huh.
had to come and get me later. Yeah. Yeah, but my
Okay.
brother, I have brothers and sisters there. Basically, all of my family is there. We have a small group of family here that spread out throughout the United States, like in New York and Florida. Yeah, but
Mm-hmm.
most of my family is in Jamaica.
Mm-hmm.
Hmm.
Okay. Do you bring that type of culture into your professions too?
I wouldn't say my culture. I wouldn't say I bring it into my profession. Yeah,
Uh-huh.
yeah.
Okay. Okay. Um, what was the name? Next question I was going to ask you. And, but it's going to get to the next segment. I do have a segment. You like playing games, right?
Okay, I don't know now. It depends on what type of game it is.
So basically, this game I call it "Think Before You Speak." So basically,
Think
I
before
ask you a question. Say it again.
No, I was just repeating what you said.
Think before you speak. So basically, I will ask you a question like, "What's your favorite flower?" or so, and you'll have to give me your answer, and you tell me why. And so basically, or I might throw out a riddle here and there, and so that's what basically the game, how the
Okay.
game goes. So you ready?
Okay. Yep.
All right. So the first question I'm gonna ask you, um, I know I said about you just teach me youth school and all.
Mhm.
So what's your favorite scripture?
What's my favorite scripture? Probably Romans 8:28, and Philippians 4:13.
Not Romans 1:16?
No, that was for the team ministry. That was for the team ministry. Yeah.
All right. What is your favorite movie?
My favorite movie? The Lion King
Hmm.
and Dumb and Dumber.
Oh, that's good. That's
Yeah.
good.
Those
Okay.
those two.
Why Dumb and Dumber though?
Because I love to laugh. Like if you really, really get around me, I love to laugh. I will make people laugh. I like cracking jokes. Like I just love to laugh.
Okay. Okay. What is your favorite flower?
I don't think I have a favorite flower.
You don't have a favorite flower? All right,
Mm.
give me your favorite season.
Spring.
Spring. You the
Yeah.
first person I heard that said spring. Every time I ask
Spring.
somebody, they say like winter or summer. Wow.
Mm-mm. I
Why
can't do
spring?
winter. Spring because it's a in between. It's not too hot and it's not too cold. And then I love when the flowers bloom and the trees bloom and everything. It's just, beautiful.
All right, all right. That's good. So remember I told you I got some riddles for you, right?
Yeah.
They're gonna come in hot too. So
Uh-oh.
so the first riddle I got, what question can you never say yes to?
What question I can never say yes to? I don't know. What question I can never say yes to. So basically, what am I always going to say no to?
Kind of something similar like that. Something similar.
Question I can never say yes to. I don't know. I don't know.
Just take a guess. I'll give you 3 tries. Just take a guess.
Take a guess. So there's an answer to it.
There's an answer to it. I'll tell you
Oh,
that.
so what question can you never say yes to? Um,
You want a hint? I give you one hint though.
yeah, give me a hint.
You do it every day. I would say you have to do it every day. I'll put it like that. You have to.
Never say yes to.
Take a time.
You have to do it every day, but I
You
can never say
have to
yes
do it.
to it.
Yes, you have to do it every day.
I have no idea.
You have no idea.
But you say I can't say yes to it.
Yeah, you can't say yes to it. Just take a guess. I said take a
Well,
guess.
it's I don't know.
All right, I give you this one. Are you asleep?
He's so stupid. That's it. Why I can't say yes to it?
I knew you weren't gonna get that one.
Man.
So the next one, I got another one. The next one is two fathers, two sons are in a car, yet only three people are in the car. How?
So two fathers
Two
and
fathers,
two sons are in a
two
car.
sons are in the car, yet only three people are in the car. How?
Because there's three people, but then you got two fathers and two sons. So there, you got three people. It's not.
You want me to read the question again?
Read the question again.
Two fathers, two
Two
sons
fathers.
are in the car, yet only three people are in the car. How?
How? Well, there's four people total, so there are three people in the car.
Mhm.
That's how.
That's how?
Yeah.
That's your final answer.
There's three people in the car. There's at least three people in the car because there's four total.
I'm gonna give
And
you
there's
another
at
try.
least three people. Huh?
I'm gonna give you another try. I'm gonna say the question again.
Okay.
Two fathers, two sons are in the car. Yet
You say
only
car,
three
right?
people.
C-A-R.
Car, yeah, car.
Okay. Car.
Oh, yet only three people are in the car. How?
Yet there are only three people in the car. How? I don't know. I just
I think that's some good one.
how? How? There's four people, so there's three people in there. There's three people in there at least.
You ready for the answer?
What's the answer?
The grandfather, the father, and the son.
What?
I knew you weren't gonna get that one either.
No. These some tough riddles.
So this one I did look up a Bible study riddle too as well.
Okay.
So this is the last riddle I got for you.
All right.
So you should know this one. I believe this one was
You
easy.
see now, I'm not a Bible scholar. Let's clear that up now.
A path made dry beneath the sky, where once was water. My people pass by. What am I?
A brook.
That's your final answer?
A brook or riverbank? Say it one more time.
A path made dry beneath the sky, where once was water. My people pass by. What am I?
You say, what am I?
What am I?
What am I? Say it again. Read it again. I'm gonna say you said what, so that means it's not a person.
It's not a person. It's not a person. I give you that. It's not a person.
Okay.
A path made dry beneath the sky, where once was water. My people pass by. What am I? It's not a person. I tell you that. Just
Read it again. Read it again.
how can I actually? A path made dry beneath the sky, where once was water. My people pass by. What am I?
You said it's not a person, and you say my people.
It's not a person. It's not a person. I tell you that. I tell you this. I give you another hint. How can I put this? It departed. I put it like that.
The Red Sea.
There you go.
Oh, okay. You said my people.
It did say my people. My people passed by. My people did pass by the red.
My people, the red. Okay. I got one out of three. Okay.
That was good. That was good.
Yeah.
I like that. So another question I did want to ask. I asked this question with everybody whenever we close to ending the podcast and all. If you got any advice, right? And if we can go back any age, and I'm talking about, let's go back 15 or so.
Okay.
If you got any advice to your 15-year-old self, what advice would you give your 15-year-old self?
15. Wow, that's a long time ago. In what, 10th grade? Whew. I would say, you say what advice?
What advice would you give your 15-year-old self?
Be more confident in your abilities. Be
Mm-hmm.
more confident in your abilities, as well as your academics. Because I was the type of person, like I was really smart, but at the same time, I didn't want people to know that I was smart.
Mm-hmm.
So, yeah, I would just say be more confident in your abilities. Yeah.
Oh,
And
that's
don't be
interesting.
afraid to be unique.
That's
Mhm.
that's that's interesting. I don't see you the type that wouldn't have no confidence. I see you the type I always have.
15. At 15, you
Oh,
got
at
a lot
15.
going on. You got a lot going on at 15.
So what made you get out of that stage and regain some confidence?
I mean, just growing up, just life and things that occurred, and I would say just life and growing up and maturing. Hmm.
Okay. Okay. All right. So what could we expect later on down the line? I would say about 5 years or 10 years from now from Tasha Scott. I'm sorry.
You keep saying Tasha, it's Tisha.
Tisha. I don't know why I keep doing that. I don't know why.
It's my
But
sister's name is Tasha though.
right.
Yeah.
So what could we expect or see for you 10 years or 5 years from now?
Definitely another book or journal for sure. And I would say there's something else that I can't speak on, but
Uh-oh.
yeah.
Uh-oh.
Yeah, can't speak on it.
We can't get
I'll
no
let
exclusive?
I'll let God handle that one, that
Okay.
part.
Okay. All right. So this was a good one. I would say.
I enjoyed it for sure.
Right. Would you come back for another one?
Oh
Would you
yeah, for
say?
sure.
All right. I might have some more tough riddles for you next time.
That's fine. I love the riddles.
All right. So y'all know what it's saying. Day by day to see a better day. Smooth for life. We out.